traffic injury treatment, best practices, and evidence-based care. Best practices and evidence-based care integrate three basic principles. 1. The best available research evidence bearing on whether and why a treatment works. 2. Clinical expertise, or clinical judgment and experience, to rapidly identify each patient's unique health state and diagnosis, their individual risks, and the benefits of potential interventions. And 3. Patient preferences and values. This is a way of providing health care that is guided by a thoughtful integration of the best available scientific knowledge with clinical expertise. This approach allows the practitioner to critically assess research data, clinical guidelines, and other information resources in order to correctly identify the clinical problem, apply the most high-quality intervention, and reevaluate the outcome for future improvement. Evidence-based care contains three elements: research, clinical judgment, and patient values. Best practices are clinical judgments regarding patient care that are informed by the best evidence and balanced by patient complexity and provider experience to improve the quality and reduce the costs of care. The clinical decision-making is according to evidence-based research. However, it is also outcome-based, encouraging innovation for the future of healthcare delivery. When a provider determines that prolonged or continued treatment is indicated within an episode of care, the following criteria are necessary. 1. There is a reasonable expectation for improvement, or the patient is demonstrating a reasonable rate of improvement. A reasonable rate of improvement would be influenced by condition chronicity, patient age, comorbid factors, frequency of care, and exposure to activities that would impede progress. And 2. If sufficient evidence exists demonstrating that reduction or withdrawal of care has and will continue to have a deleterious effect on the patient.